Hello, I'm Dr. Valerie McLaughlin, Director of the Pulmonary Hypertension Program at the University of Michigan. I'm joined today by Dr. Richard Chanik and Dr. Ioana Preston, and today we're going to discuss some of the key takeaways from the 6th World Symposium on Pulmonary Hypertension. Dr. Chanik, one of the most interesting recommendations from the symposium had to do with changing the definition, the hemodynamic definition of pulmonary hypertension. Why don't you summarize that for us?
Yeah, Val, so historically or previously a cutoff of 25 millimeters of mercury for the mean pulmonary artery pressure defined pulmonary hypertension. And that was based on sort of a consensus definition. Well, at the World Symposium, this was looked at much more sort of systematically. And what was found, if you really reviewed normal data, large data sets, the normal pulmonary artery pressure is nowhere near 25. In fact, it's about 14 millimeters of mercury on average. And if you do sort of two standard deviations above that, 20 becomes really the true upper limits of normal. So the decision was made after a lot of discussion to define pulmonary hypertension as a mean pressure greater than 20 millimeters of mercury. Now, one other very important point is that what the panel really wanted to do was avoid sort of overdiagnosis, for instance, patients with a high cardiac output or a high wedge pressure causing this mildly elevated PA pressure. So the introduction that the PVR has to be greater than 3 Wood units, I think is a very important part of that. So we now define precapillary pulmonary hypertension as a PA mean over 20 with a wedge less than 16 and a PVR greater than 3.
Right, so that's the new definition. I think the other important point that was made, again, based on some recent literature, that these borderline pressures, 20 to 25, have been associated with poor exercise tolerance, higher mortality. So that added some fuel to that discussion as well.
It did, yes.
And so, Dr. Preston, now that that definition has changed, can you tell me how that impacts the clinical classification of pulmonary hypertension?
Val, the clinical classification has remained the same. We still have 5 groups of pulmonary hypertension as before, but it's the incorporation of the hemodynamic definition that has changed and that has expanded the pool of our patients with pulmonary hypertension. So we have the same clinical scenarios or types of pulmonary hypertension.
Right, so for group 2, the new hemodynamic definition would be
changed to a mean PA pressure of over 20 is abnormal. In group 2, we have the hemodynamic definition of abnormal wedge pressure above 15, and if there is a precapillary component, the PVR would be over 3 Wood units.
Right, and similarly for lung disease and chronic thromboembolic pulmonary hypertension.
Correct. So all the new hemodynamic definition applies to all 5 groups of pulmonary hypertension.
Great. Dr. Chanik, Dr. Preston, thank you for joining us today. We appreciate you joining us for this discussion on the new hemodynamic definition of pulmonary arterial hypertension.